When struggling with varicose veins, one wants to explore all treatment options to avoid surgical intervention. How to achieve this will be discussed in this video. We have collected recipes from Chinese and Tibetan healers, as well as from traditional folk medicine that will protect your veins. In the video, you will learn: why do varicose veins occur? What are the stages of their development? How are vinegar baths beneficial? What folk remedies exist for treating varicose veins? How is this condition treated in Tibet? How do drinks affect varicose veins? How can the disease be overcome with honey compresses? Why do varicose veins develop in the lower limbs? This condition is caused by insufficiency of the venous valve apparatus, resulting in difficulty of blood outflow from the lower limbs. Blood stagnates, leading to vessel expansion. The following factors predispose individuals to this condition: genetic predisposition, constant prolonged strain on the legs, repeated injuries to the lower limbs, pregnancy, obesity, use of hormonal medications, lack of physical activity, predominantly sedentary lifestyle. The disease develops gradually and can lead to complications and severe consequences. What are the stages of lower limb venous disease? There are 4 stages of progressive venous insufficiency and vessel damage in varicose veins. Stage 1, the initial stage, where there is no venous insufficiency yet. The first symptoms of the disease are present, but blood flow is compensated. At this stage, the following symptoms are identified: frequent feelings of tiredness in the legs, sensations of burning and soreness along the veins, swelling of the calves and feet, frequent cramps, especially during sleep, bluish discoloration of the skin, appearance of spider veins. These changes manifest in the evening hours, with symptoms mostly subsiding by morning. Stage 2, subcompensated vascular insufficiency. Here, clinical manifestations are much more intense. Patients experience intense leg pain, significant, almost constant swelling. Cramps occur even during the daytime. Visible contours of enlarged veins on the legs, with altered vessels featuring thickened walls and nodules. The skin of the calves and feet becomes thin, scaly, and pigmented spots may appear. At the second stage of varicose veins, the disease significantly makes itself known. Treatment is required. Stage 3. At this stage, the process is decompensated. Enlarged, twisted veins with dense nodules are noticeable on the legs. Blockages by clots and inflammation of the veins are common. The skin is dry with non-healing trophic ulcers and pronounced skin pigmentation, severe swelling. Stage 4. Continuously progressive course of the disease. Patients suffer from severe vascular insufficiency. Veins are so enlarged that they may burst, leading to bleeding. Severe swelling, non-healing ulcers, and constant thrombophlebitis. Having the disease at any stage requires careful attention and proper treatment aimed at alleviating symptoms and preventing the progression of the disease. As additional measures to the prescribed medication therapy, the use of folk remedies is possible. How exactly is varicose treated in folk medicine? There are many methods. We will start with the use of vinegar to combat this condition. How can vinegar baths help? What's the role of vinegar? The composition of this affordable household item impresses with its richness and balance of beneficial substances. Vitamins A, B, C, E, P, and beta-carotene are essential for maintaining the tone, elasticity, and youthfulness of the skin. The mineral components of vinegar, namely calcium, potassium, silicon, magnesium, copper, sodium, phosphorus, and sulfur, are nourishing elements for nails, cartilage, and bones. Absorbed into the skin, they replenish the deficiency of these microelements in the tissues of the lower limbs. And importantly, the most critical antibacterial and antifungal element in vinegar is a set of organic acids. This product is rich in carbolic, citric, lactic, oxalic, malic, propionic, and, of course, acetic acids. When are vinegar baths beneficial? Firstly, this simple procedure is excellent for solving cosmetic issues, quickly and painlessly removing corns, calluses, and cracks on the heels. One of our subscribers shared that she got rid of an old corn in just 10 sessions. Secondly, vinegar effectively combats foot sweat, fungi, and ringworm. Thirdly, Baths with apple cider vinegar are recommended for the development of varicose veins. If the first venous stars appear, it's crucial to start using vinegar to address the issue immediately. It helps improve blood circulation and normalize the condition of the vessels and veins. Since vinegar contains many beneficial microelements, including calcium, baths with it strengthen the nails, protecting them from cracks and the development of fungal infections. Finally, perhaps one of the most important properties of vinegar is its ability to reduce bone pain and relieve leg fatigue. That's why baths are even recommended for young, healthy individuals who lead active lifestyles and engage in sports. Many athletes say their coaches advise them to regularly use vinegar to relieve tension after intense workouts. Is there any harm from using vinegar? Despite its many beneficial properties, vinegar baths have contraindications. The first one is diabetes. People suffering from this condition should avoid vinegar baths, as vinegar worsens the trophic condition of tissues affected by diabetes. The second contraindication is pregnancy. Here, the concern isn't with vinegar itself, but with the foot-warming procedure, which can provoke a miscarriage or preterm labor. The third obstacle to this therapy is thrombophlebitis. In this disease, the walls of veins and vessels are inflamed, and baths may exacerbate the process of thrombus formation. The fourth contraindication is atherosclerosis of the vessels. In this case, baths can also be dangerous, so the decision to use this procedure should be made by a doctor, considering the patient's specific condition. And don't forget that vinegar, even apple cider vinegar, has an irritating effect. Therefore, do not take these baths if there are wounds, abrasions, or cuts on your feet. How to properly take vinegar baths. There are several recipes for this procedure, varying depending on the goals. The baths can contain just vinegar and water, or additional ingredients like salt and baking soda. Why are they needed? Salt enriches the skin with sodium ions, which is effective for joint pain. Even more effective is using Epsom or English salt instead of regular salt. This substance is high in magnesium, which not only relieves pain and fatigue, but also prevents the occurrence of night cramps. Baking soda is a component of baths that helps soften and remove fungus on the skin and nails. The first recipe is for a fungal bath. Mix 1.5 liters of water with half a cup of vinegar. Keep your feet in this mixture for 15 minutes, then apply a paste made of baking soda and water to the fungus-affected areas for another 15 minutes and rinse off. Such baths should be taken as a preventative measure after visiting public pools, saunas, and other places where there is a risk of contracting fungus. For treating an existing condition, a course of 10 procedures is required. After that, take a break and repeat the course until the effect is achieved. To combat foot sweat, dilute half a cup of vinegar in 5 liters of water and soak your feet for 15 minutes. Take such baths regularly to achieve a lasting effect. The same recipe will help soften the skin of the heels and relieve foot fatigue. And to relieve joint pain, add a cup of sea salt or Epsom salt to the mixture of water and vinegar. The latter option is more effective. Such a bath should be done at night. The water in the bath should be warm, but cool water is better for relieving foot fatigue. Another folk remedy is cedar oil vein massage. Many traditional healers recommend using cedar nut oil to combat varicose veins. To do this, apply a small amount of oil on your fingers and rub it onto the areas along the affected veins, performing a gentle massage until it is fully absorbed. Repeat twice a day. Lemon compresses. Recipe number 1. For varicose veins, it is recommended to apply slices of lemon to the affected areas, cover them with a layer of cigarette paper on top, and then wrap with a bandage to hold the compress firmly in place. Leave it on for 20 minutes before removing. During acute varicose conditions, it's advised to apply such a compress up to 2 to 3 times a day. Recipe number 2. As a base for a varicose vein compress, you can use a common cabbage leaf, previously washed in water and soaked in olive oil for 1 hour. Take the prepared cabbage leaf, sprinkle it with 2 to 3 pinches of baking soda, and squeeze half a lemon over the top. Apply this compress to the affected area for 20 minutes. Propolis ointment. To prepare a propolis ointment for varicose veins, you will need 10-15 grams of propolis and 50 grams of butter. Crush the propolis to a soft consistency, then mix it with the butter and stir until smooth. Then heat the mixture until it boils. Turn the heat to very low and simmer for 5-7 minutes. After that, remove the mixture from the heat, cool it, and strain through cheesecloth or a very fine sieve. Apply the resulting ointment daily to the affected areas, leaving it unwashed. Contrast garlic foot baths. The principle behind a contrast foot bath is straightforward. You immerse your feet in hot water for 2 minutes, then move them to cold water for 30 seconds, for example, in a basin prepared in advance. After that, you alternate between hot and cold water, following the same scheme. The procedure lasts for 20 minutes, during which you switch between hot and cold water 10 times. Now let's look at the recipe for preparing a hot garlic foot bath. To do this, peel 30 cloves of garlic, crush them, and put them in an enamel pot. Fill it with 10 liters of boiling water, place it on the heat and boil for about half an hour. Remove from the heat and let it steep for 8 hours. Heat the resulting broth to +140 degrees Celsius, 104 degrees Fahrenheit, and pour it into the bath. If there is not enough water to immerse your feet, add warm water to the required volume, following the recommended proportion. For example, for a sitz bath, the ratio of broth to water should be 3:7. For a full body bath, 1:10, and for a foot-only bath, 1:7. A simple garlic and honey recipe. A remedy for varicose veins requires 250 grams of garlic and 350 grams of honey. Peel the garlic and grate it, then cover it with liquid honey, preferably freshly collected, though this is not critical. Mix the mixture until smooth and let it infuse in a dark place for 7 days. Take 1 tablespoon of the ready mixture 3 times a day, 30-40 minutes before meals. Repeat daily for 1.5 months. Then, take a break for a couple of weeks and, if desired, you can repeat the course. How do they fight varicose veins in Tibet? What experiences from the residents of Tibet can we utilize to maintain and restore our health? Which techniques are particularly popular there and have proven to be highly effective? Can they cause any harm? We will discuss this right now. According to medical professionals, practicing the exercises you will learn about shortly has led to individuals with severe varicose veins in their legs, who found it very difficult to move around independently, starting to walk normally after some time. Of course, this is not the only treatment, but when combined with main therapy, such an exercise significantly contributed to reducing the symptoms of varicose veins. To understand its mechanism of action, it is important to recall that varicose veins are the result of malfunctions in the valves inside the veins. Normally, they should open when the heart contracts and close completely as it relaxes. However, in the case of varicose disease, this does not happen completely, so the amount of blood remains elevated in the lower parts of the body for obvious reasons. Against the backdrop of overall weakness in the vascular walls, there's a gradual enlargement and stretching of the veins, leading to varicose veins. What needs to change to not only prevent all of this, but to also reverse the course of the disease? First and foremost, exercises aimed at improving blood flow to prevent significant fluid stagnation in the legs are required. How can you perform some of the simplest exercises? They can be done without even getting up. Simply sitting comfortably, start with alternating toe movements towards and away from you, aiming for good calf muscle tension. The duration of the described actions should be adjusted based on your own level of physical activity and the overall severity of the varicose condition. In severe cases, it is advisable to start these exercises without exerting too much effort. How else can these workouts be enhanced? For greater efficiency and better blood and lymph flow, similar foot movements can be performed not in a semi-sitting position, but lying on a horizontal surface with legs raised. In this way, blood naturally tends to flow downward, and leg movements will enhance this process. Even with severe varicose veins, there will be significant relief from heaviness immediately after finishing the workout, and over time, the effect will last increasingly longer. The second exercise is the classic bicycle. This requires lying on your back, bending your legs at the knees, and then beginning to alternate rotations as if pedaling a bicycle. The duration of this exercise should also be adjusted individually. As your condition improves, the intensity and duration of these and other similar exercises will naturally increase. The third type of movement involves alternating bending of the legs, stretched upward. This way, the knees will be worked on, but there will be minimal dynamic load since only the weight of the lower part of the leg will be on the joints. It is desirable not to touch the tip of the foot to the floor after bending, but to press the shin against the thigh with some effort. This will provide greater engagement of the deep-seated muscles and a more intense massage of the veins closer to the outer surface of the back of the shin. Overall, these exercises do not pose any danger, but nevertheless, what precautions should be taken? Ideally, all this should be done under medical supervision, especially in cases of severe, advanced varicose veins. Therefore, when doing these exercises at home, it is necessary to gradually and carefully increase the load to avoid any undesirable consequences. With a careful approach, all the described movements will simply become an effective aid in combating varicose vein expansion. And in combination with the primary treatment, the first improvements will come in the shortest possible time. Blood viscosity directly affects the progression of varicose veins, and among the methods of thinning the blood, the simplest one is to drink more fluids. But we're not talking about just any beverages. And now we want to tell you more about harmful and beneficial drinks for varicose veins. Which beverages are harmful and which are beneficial for varicose veins? Which drinks lead to pronounced blood thickening? How can you notice the manifestations of this pathology? And how to compensate for the already disturbed blood rheology? You will learn all about this from our next segment. So, which drinks and how do they affect our blood? The following types of fluids have an effect. Sweet carbonated drinks. They always contain either regular sugar or its natural substitutes like fructose or synthetic sweeteners, most of which cause specific harm to internal organs and overall human health. Strong coffee and tea. Both drinks contain a large amount of caffeine. The tea variant is also called theine, analogous to guarana extract. It narrows blood vessels, accelerates heart rate, and triggers increased adrenaline production. All of this negatively affects the condition of blood vessels and blood functions. Alcoholic beverages. We believe it's unnecessary to provide evidence of their harm, but we'll just remind you that alcohol causes increased fluid excretion even in cases where there is no edema. All this leads to insufficient blood volume, and consequently its pronounced thickening. Infusions of nettle, St. John's wort, yarrow, and other herbs for bleeding directly trigger the mechanisms of platelet formation and activation, the main cells for stopping bleeding in case of traumatic skin damage. Thick juices. Despite their objectively liquid state, the body perceives thick juices as food and initiates the synthesis of necessary enzymes and digestive juices. Tomato juice with added table salt possesses special properties to thicken the blood. Many people consider it a good laxative for this reason. When consumed on an empty stomach, it often leaves the body almost unchanged in the same form. What can we replace these drinks with, and how can we compensate for the lack of fluid in the circulatory system? Of course, we should start with drinking plain cool water without any gas content. The average volume is probably familiar to you, about 2 liters per day. However, you can supplement water with other beverages containing natural salicylates, for example. They will act similarly to aspirin, but won't lead to possible side effects. What beverages can be used to thin the blood and strengthen blood vessels? For example, you can prepare the following drink. What will you need to take? 2 apples. They contain apple, lemon, and tartaric acids. They cleanse the inner walls of blood vessels from excess cholesterol deposits. 20 grams of ginger root. Fresh pulp contains a large amount of gingerol, a substance with a wide range of pharmacological activity. 100 grams of red grapes. The berries contain resveratrol, which effectively strengthens blood vessel walls and helps them stretch effectively. 1 pomegranate. It contains a large number of essential vitamins beneficial for the functioning of the heart muscle. Half a lemon. The natural acids in it will contribute to blood thinning. Preparing the drink is quite simple. Rinse all the ingredients and separate the pulp from the skins and seeds. Then chop everything with a blender and strain the juice. After that, boil 1 liter of water and add all the pulp. Let the mixture infuse and cool down on its own. This remedy should be taken in reasonable amounts several times a day. Caution should be exercised in the presence of gastritis or ulcerative lesions in the stomach or intestines. We've already talked about the benefits of honey for treating varicose veins, but it's such a unique and irreplaceable product that there are many recipes based on it, and one of them has long been successfully practiced in Chinese medicine. Here's how honey is used there for varicose veins. How can a honey compress help with veins? Honey in Chinese medicine. Among the described products, special attention should be paid to honey. In addition to its role in providing vascular elasticity, this product has antibacterial properties and also normalizes digestion and stool. Therefore, it has been used since ancient times for various ailments. The antiseptic properties of honey have been known in China for thousands of years. And considering that venous stasis leads to impaired blood supply to adjacent tissues, the risk of ulcers on the legs increases with this condition, and they, in turn, become a nutrient medium for bacteria. So, honey is the best way to prevent such consequences. Therefore, its local application allows for comprehensive intervention in varicose veins. There are many positive reviews about the Chinese method. People note that it has helped stop the progression of the disease and improve the condition of the blood vessels. How to apply it at home? Let's talk about it right now. Chinese varicose vein compress. To treat according to this method, you will need honey and cotton fabric. Apply honey to a piece of fabric with a medium layer and apply it to the area affected by varicose veins. Wrap it with cling film and secure it with a bandage. On the first day, keep the compress for 2 hours. On the second and third days, keep it for 4 hours and then apply it overnight. The course of treatment is 2 months. During this time, you will see an improvement in the condition of the veins and feel that pain and fatigue in your legs have decreased, while their endurance has increased. How do you treat varicose veins? Tell us about effective methods of combating this disease.